A very warm welcome to everyone, and thank you for joining us for this very first inaugural Pacific Resilient Partnership Webinar Series. My name is Vasi Pisoko, the Director of the National Disaster Management Office, and also the co-chair of the Pacific Resilient Partnership Technical Working Group on Risk Governance and your moderator for today's webinar. Also present with me on the table is my colleague Nasake, as well as Napoleoni. To start the session, and this is at this very first PRP series, we are joined by the PRP Task Force, Mr. Engel Regadas from French Polynesia, who will deliver his opening remarks on behalf of the PRP members and partners. Mr. Regadas, the floor is yours.
Yaorana and greetings from Tahiti. In addition to the warm welcome by Madam Moderator, I also convey on behalf of the Pacific Resilience Partnership Task Force our appreciation to everyone who has made the time to join us in this inaugural PRP Webinar Series. The webinar series is part of the ongoing advocacy of the framework of the resilient development in the Pacific and its complementary governance mechanism, the Pacific Resilience Partnership, endorsed by our leaders as a means to elevate and enhance how we implement resilience actions in a more coordinated and coherent manner. It builds on the 2019 Pacific Resilience Meeting, providing a platform inclusive for all stakeholders to share, learn, and showcase innovative practices as a means to drive and facilitate enhanced resilience actions. We are all here for a common objective, which is to ensure that our region, our countries, communities, and peoples are able to withstand and mitigate the impacts of climate change and disasters. Our leaders, when they endorse the FRDP and the PRP, they recognize that their potential to support coordination and action is on a number of key issues related to climate change and disaster risk management. However, to translate this vision of our leaders into reality, our commitment to work together is key. And I hope that the turnout today is indicative for that commitment. Building resilience is not confined to just one sector, but as we will learn through today's session, it is also about the policies and legislations that provide the enabling environment to facilitate effective responses and actions. I thank the Republic of Marshall Islands, Fiji, and Tuvalu's National Disaster Management Office's director and colleagues for giving us this opportunity to hear from them and for partnering with the PRP to moderate and facilitate this session. I encourage everyone to engage and learn and look forward to fruitful discussions. With these few words, I officially declared the start of the Pacific Resilience Partnership Webinar Series. Thank you, everyone, and thank you, Madam Moderator.
Thank you, sir, for the words of encouragement as well as word of wisdom that will guide the discussion that we'll have today. The webinar today focuses on the experience of three of our countries faced in the context of multi-hazard impacts, inclusive of COVID-19. What you will hear today is how those at the front line of their national responses had to deal with these issues within the constraints of existing policies and legislations. At times like this, innovative approaches were all really key, with our decision makers having to come up with the solutions that are at the heart of it, was to also ensure safety and well-being of our people despite the gaps that we've identified under the law. Our colleagues, such as the director from various NDMO around the region, would have had to demonstrate a certain amount of flexibility to implement the directives, policies, and legislations at hand as part of the response message to such hazard. The TWG risk governance provides an opportunity to highlight the gaps and the opportunities around our governance arrangement, and in the process identify possible areas of support towards further improvement. Having both the Attorney General and the NDMO around the region as members of the TWG provides a unique opportunity for peer-to-peer exchange amongst those responsible for drafting this legislation and those responsible for implementing such legislations, including our partners supporting any such system of reform. This webinar is only part of the process and should stimulate discussions around the early lesson learned and how disaster and climate risk governance can further strengthen at local level. The questions that will guide the discussions today are: what were the policies or the legislation processes that triggered during COVID-19, including other natural hazard experienced recently? And number two, where do you see opportunity to strengthen policies or legislation processes within a multi-hazard impact at both national and regional level? In terms of modality, we will hear first from first panelist, and then we will open the floor for question and answers. I now have the pleasure to introduce our first panelist for this session, Mr. Sumio Silu, the Director of Tuvalu National Disaster Management Office, who will share with us Tuvalu's experience as one of our smaller island states managing the dual impacts of COVID-19 and TC-TINO, as well as the lesson learned that we can take from it. Mr. Sumio, Director, the floor is yours.
Greetings and aloha from Tuvalu and Yemo. I hope our partners, our friends and colleagues are healthy amidst the pandemic COVID-19 that affect the global United States. TC-TINO affected all islands of Tuvalu between the 17th and the 24th of January early this year. A state of emergency for TC-TINO was declared under Section 26 of the Disaster Management Act. The state of emergency, special powers, regulation for TC-TINO commenced on the 28th of February. National Disaster Committee and all island disaster committees were all activated during this period. NDMO at the States was occupied with the development of the TC-TINO Recovery and Vulnerability Reduction Plan, and we are focused on the response and early recovery actions because of TC-TINO, which had impacted all islands of Tuvalu. The first reported case of COVID-19 in China was on 1st of December 2019, which quickly spread overseas. Within 2 months on January 25th, the first reported case in Australia was reported, followed by New Zealand on February 28th. WHO declared COVID-19 as a global pandemic on March 11th. Even though the Ministry of Health had recently developed contingency plans for COVID-19 in partnership with WHO, all other government departments were not prepared for the pandemic of this magnitude. So the Prime Minister, under powers stipulated in the Constitution, convened a high-level national task force for COVID-19 on the 3rd of March. As a result, subcommittees were established to oversee 7 different sectors with the overall objective of keeping Tuvalu COVID-19 free. Subcommittees included infrastructure, education, finance and food security, health, transport, repatriation and relocation, civil service and legal affairs, and lastly, security and border control. One of the outcomes of the 7th subcommittee was the formulation of the Taraliki Plan, which is a compilation of the national level contingency plans by all 7 subcommittees based on COVID-19 alert level and response plan metrics. When the first reported case in Fiji was recorded on 19th March, Tuvalu declared its second state of emergency for 2020. The following day, this time for management and minimization of the impact of coronavirus. In effect of closing of all airspaces and maritime borders with an exception of cargo ships and film taggers allowed in the country. At the national level, the existing legislation under Section 3 of the National Disaster Management Act provides for an extensive list of disaster and multiple hazards. However, there is a need to strengthen the multiple hazard approach and consider the evolving nature of disasters under the legislation. This provides Tuvalu with an opportunity to revise our legislation to better align prevention and response efforts across all relevant government, non-government agencies, and committees. The existing legislation governing disaster is the National Disaster Management Act of 2008. Despite the successful management of past and present disasters under the current legislation, there have been several national, regional, and international development in disaster risk management that we would like to be integrated into our National Disaster Management Act. We need feedbacks from our community and in-country stakeholders on how we deal with disaster while the country is still coping with another disaster. For example, the COVID-19 state of emergency while the country was still under the TC state of emergency. We also need to clarify the declaration of a state of emergency under the National Disaster Management Act and the powers conferred to the NDMO when there are two disasters occurring simultaneously. We need to streamline sections in the National Disaster Risk Management Arrangement with sections in the National Disaster Management Act in order to ensure a holistic approach that is inclusive of all government departments and relevant stakeholders at all levels. At the regional level, Honorable Simon Coffey, Minister of Justice, Communication and Foreign Affairs, chaired the inaugural meetings for the Ministerial Action Group, which developed 5 protocols for countries in the region to deal with the pandemic. Another regional mechanism that needs to be commended is the Pacific Mediterranean Pathway on COVID-19 under the Piketawa Declaration. This will provide the enabling political environment and commitment to expedite assistance and cooperation between member countries in preparing for and responding to COVID-19 by enabling the provision of medical and humanitarian assistance from regional, international, and developed partners in a timely, safe, effective, and equitable manner. At the regional level, we hope for and anticipate the sharing of best practices and lessons learned from our countries in the region. Sharing of best practices with the region will enable our countries to contextualize lessons learned for their own benefits. At the national level, the task force is responsible for all action in country, while at the island level, the Kaubule are responsible for actions on the island. This shows that Tuvalu is working at all levels to mitigate impacts of the 2 disasters that Tuvalu is currently facing. Recovery from TC Tino and the immediate threat of COVID-19. We do believe that the Pacific must uphold principles of the fallibility concept and that we must all work together harmoniously as we all have a moral obligation to care for and to protect ourselves and our neighbors. I thank you, Madam Facilitator.
The Director, thank you for the timely presentation as well as enlightening the members of the forum about the important role that the NDMO Tuvalu played during TC Tino as well as COVID-19. You know, the similar sentiments can be shared as well for other Pacific Island countries across the region, including Fiji. Members of the forum, just for your information, we'll introduce or we'll have the 3 presentation and then we'll have your question and answers. We ask that should you have any questions, to please prepare them. When we ask that you raise your hand, you can then share your question with the public. For now, I have the pleasure of introducing then our very own Disaster Risk Reduction Officer, Mr. Mesake Matetonga, an officer with the Fiji National Disaster Management Office, who will share with you Fiji's experiences as one of the bigger island states who actually had COVID-19 cases, including TC Tino and TC Herald, which impacted across Fiji, as well as lessons learned that we can take from it. Mr. Matetonga, the floor is yours.
Thank you very much, Madam Chair, and greetings from Fiji, and thank you very much, Tuvalu, for your beautiful presentation and the lessons that you've shared with us as NDMO family. Fiji is a special case when it comes to the current situation. First, we had a total of 3 tropical cyclones which impacted the Fiji Islands and those that come very near to Fiji waters. That is Tropical Cyclone Tino and also Tropical Cyclone Herald. Before Herald, we also had one of the first cases of COVID-19 here in Fiji. This is very special for us because, given the fact that it's a declared pandemic at the global level, Fiji's approach to this in terms of legislations and policies, there is the Public Health Act, and also in Fiji we have the Natural Disaster Management Act, which play also a role in terms of declarations. So when TC Herald struck, a declaration of natural disaster was declared, and at the same provision, COVID-19 was also declared under the same powers. So the Natural Disaster Management Act has been tried and tested over the years, given that the structure itself connects both at national, subnational, and down at community level. Of course, the Ministry of Health have done a very terrific job in containing it under the Public Health Act of 1935. And for those of you who are able to research further on this in terms of Fiji's legislation, a total of 8 amendments to existing laws were done with regards to COVID-19 to ensure that COVID-19 actions and implementations of those actions to ensure the containment. So Fiji currently is COVID-19 safe. We have cases here currently, but it is contained. So those amendments in the legislations, about 8 of them were amended, and 1 new act, which is the COVID-19 Response Act of 2020, was also formulated. And this is how we react to the current situation. And as stated earlier, what are the opportunities in which these current events can provide to us in terms of improving our legislations and policies? Fiji was fortunate that before COVID-19, we launched our National Disaster Risk Reduction Policy. This is a direct translation at global level. You have the Sendai Framework for Disaster Risk Reduction, and at regional level, you have the Framework for Resilient Development in the Pacific, which collaborates climate change adaptation and disaster risk reduction. So in Fiji's case, we have the National Disaster Risk Reduction Policy, which advocates on proactive measures, which advocates on streamlining disaster risk reduction in all sectors, and ensuring a whole of government, whole of society approach when it comes to risk management. Disaster risk management is everyone's responsibility, from the very high powers of government to the grassroots levels. Everyone have a role to play, and that's what the policy is directing Fiji towards when it comes to mainstreaming disaster risk reduction in such perspective. And how does this current situation provides an opportunity to Fiji's legislation when it comes to disaster management? Particularly, Fiji is currently reviewing our Natural Disaster Management Act of 1998. So just by the name of the legislation itself, it's Natural Disaster Management Act. So it sort of limits the provision that we only focus on natural disasters, and all of us, as we are aware, disasters are not natural. You have also man-made disasters, technological disasters. So this is an opportunity for Fiji to further inform our legislation review process of our 1998 law that deals with disaster management, to open it into a national disaster management legislation that is inclusive, that takes into account all viewpoints of the whole of society, holding true to the concept of no one being left behind, and also contextualizing these global targets, indicators down to the implementation. How do we contextualize that into Fiji's case that will enable us to move forward into the future, being a resilient community and society? And we hope that the lessons learned that we learned along the way in implementing this policy will also help the Pacific. With respect to the operation side of things, when it comes to such situation, the unity of various sectors together in trying to combat both COVID-19, at the same time respond to the impacts of Tropical Cyclone Harold. This comes into our planning strategies here at the National Disaster Management Office. Given the fact that the restrictions of COVID-19 were in place when disaster struck, so we took that into account, like social distancing. Fiji was also under lockdown during that current time. What happened is when the Central Division, or SUVA, for instance, was under lockdown, most of the government offices usually go for response, were centered here in SUVA. But during the response for Tropical Cyclone Harold, and also taking into account the restrictions by COVID-19, those officers outside the lockdown areas, from the divisions, from the subnational level, were deployed to provide life-saving assistance in terms of response to those who are affected during Tropical Cyclone Harold. And also, we minimize the number of people, and there's stringent measures put in place before the officers were deployed to ensure that we do not spread COVID-19 further. Now, the success story behind this is we were able to respond within 5 days of after the aftermath of Tropical Cyclone Harold. At the same time, we also ensure that COVID-19 is not spread to the outer islands in which we are providing assistance towards. Again, I think the major lessons learned for us in the Pacific to draw out from is we need to conceptualize this huge or global initiative to our country's specific needs, and also ensure that our laws and regulations are versatile enough, flexible enough to provide leeways for such flexibility when it comes to response. Very important is our response to the people that we serve, and that we are not hindered further. So this is just to finish off, COVID-19 and also Tropical Cyclone Harold, which is a very special situation in Fiji right now, provide us with an opportunity to further consider, to further includes new ways forward when it comes to our legislation review, and also formulating policies down at community level, community at the grassroots levels. We are also looking to, in terms of community-based disaster risk management, in terms of a policy to further contextualize mainstream disaster risk reduction, and also how health sectors can be drawn down from national, subnational, and local level. These are just a snapshot of the summary of Fiji's case when it comes to dealing with natural hazards and legislation. And also for the review, we are looking at having all kinds of disasters under the DRR functionalities that biohazard as well will also be included in our legislation to make it a much more broader scope, encompassing all concepts that we just discussed. With that, Madam Chair, I thank you.
Before I move on to the third presentation, may I ask those that are interested to raise your question to please drop your question in the chat box so that the secretary can also collate the questions. So please do drop your questions in the chat box so we can also collate, and also be easier to raise the question after we move into the question and answer session. Moving on to our third presentation, he is none other than the Director for Republic of Marshall Islands National Disaster Management Office, Mr. Timmy Langry, who will share with us RMI experiences that had to deal with dengue fever outbreak, followed by measles outbreak, and now experiences from this impact informed their approach to COVID-19 and the lessons learned that we can take from it. Director Timmy, the floor is yours.
Vinaka, yago to everyone. I hope you guys can see me clearly. Don't mind the lights. For the interest of the bandwidth and the current capacity of the internet capability here in the Marshall Islands, I will then turn off my webcam if that's okay with Chair.
Director, we can see you. If you don't have this connection with your connectivity, you may proceed, please. We'd like to also put a face to Director Marshall Islands NDMO, please.
All right, let me. How does that look?
Oh yeah, looking good now, Director. Please proceed.
All right, thank you. I will, first off, I would like to take the opportunity to thank the team for giving the RMI the opportunity to present on what the RMI has been doing over the past months. And I believe I do share the screens with everyone. Please acknowledge if you all can see the screen. With that, for those who have not, I will definitely share the screen on maybe after my presentation. What you all see in front of you is the, let me minimize that. It's our current update with what RMI has been doing for the COVID-19. But prior to that, what the Marshall Islands did in regards to the measles, we've never had the measles outbreak here in the country because of preparatory measures that we immediately identified and implemented across our country. We managed to convey and advise our government for the time being, because of the limited resources in terms of physical resources, human resources, financial resources. We were able to convey the message of border control, which is keeping our borders closed while we do some preparation works on the ground. Now that is for the measles. For the COVID-19, the RMI government declared a state of emergency for the COVID-19 Although, even though we do not have confirmed cases here in the country, but in order for us to relax some of the activities per our Emergency Act and Disaster Resistance Act, in order for some of the financial movement within the procurement code to be relaxed a bit while we do the preparation works, which will then require financial movement. Moving on, again, for the COVID-19 itself, I would like to give a snapshot to the group, the wider group, for our what has been expended so far. For please bear in mind that, as I've stated before, we have not have any confirmed cases in the country. However, there are some preparation works that needs to be implemented if there will come a time if the government will choose to open the border or not. Now, that is still under discussion. However, when the state of emergency was declared, by default, the National Disaster Management Office, along with its clusters, were activated to develop a COVID-19 pandemic preparedness and response plan. What you see in front of you are the clusters with the cost estimates of the activities, where you see on the far right or on your far left one of the activities is to establish or install hand washing stations. As we all know, one of the best measures to minimize or stop the spreading of COVID-19 is for hand washing measures or activities. For that, we were able to develop the response plan that has hand washing stations, which will then be placed on the school premises. That way, we want to start practicing the hygiene practice for not just for the students themselves, but also for the general public at large. Again, the total revenue that we've received thus far. Now that number, the 42 million, it will be changed given the fact that we are coordinating closely with our development partners and also our regional partners as well. Again, those are the list of the partners or donor countries that have contributed thus far to the Marshall government. To also complement the response plans that was developed by the National Disaster Management Office with its clusters. The most active cluster was the health cluster. For that slide, that shows what percentage of money that we have received, and the percentage of the other funding from other countries that are in transit, meaning they're on the way. Haven't landed in the accounts, but we were given assurance and also the notice of award letters that the funding will arrive soon. The other slide shows the financial gap of the response plans that we've developed. However, again, the financial gap, where it's stated in front of you, it is subject to change given the fact that we are now working closely with our clusters and also our donor partners, especially the clusters in regards to their activities for the response plans. In addition to that, the activities that are reflected in the response plans, the National Disaster Management Office have conditionalized these activities based on the conditions that were advised and recommended by WHO and CDC. I'm not really sure how the other countries are conditionalizing their activities, but we have followed the advice from WHO and CDC in regards to the condition. From condition 4, which is still no cases. However, activities that are being done during that time is to do some preparation work in terms of installation of hand washing stations and also infrastructure activities such as building an isolation unit and also the quarantine unit, just to prep the countries if the government is willing to open the borders or not. Again, that is still under discussion. Now, for the updates, again, just like to give you guys an overview. We have installed 6 stations out of 19, and the materials for them have completed. Now, we must be asking ourselves, okay, why six stations out of 19 is completed? Well, like I said, one of the challenges that we face is human resources, and also the challenges that we face within our legislative framework. Although there is a declared state of emergency, it does not fully relax the procurement code that that can be expedited to, purchase the items that we need. Meaning we have to still comply with our procurement code, regardless if it's a state of emergency. Although if it was a state of disaster, then that is where NDMO and its clusters, especially the logistic cluster, which our Ministry of Finance is the co-lead for, then can, for example, do sole sourcing and whatnot. And for the infrastructure cluster, like I said earlier, the further response plan, there are activities of construction of the isolation ward in both Majuro and Ibay, another community that is densely populated, Ibay-Quadrilan, and also purchasing of medical equipment and the quarantine site as well. Now, those are, again, I will share the presentation to everyone for later down the line if there are Q&A. However, I would just like to give an update of how the activities are being implemented by clusters. For the health, again, we're not, the NDMO and the health cluster, we're not just thinking of medical equipment wise, financial wise, but also we're also thinking about search capacity. Again, because there are limited human resources that we have, we are currently communicating with our partners such as WHO and the POA, which stands for Pacific Island Health Organization Associate, which is a circle of doctors and nurses that we can utilize, again, per our compact of free association with the United States of America. And also we advocate opportunity to work with our UN agencies such as UNOPS for our medical equipment and supplies that is still underway and can be transported in the later months. One of the most important things that we also thought of was the information management of how the COVID-19 is developing in the other countries. We want to ensure that the general public at large understand the situation of other countries and understands the impacts of the disease or the pandemic. If it were to be happen here in the country. However, even though we're thinking of still conveying to the government to still keep our borders closed, it does not stop us to ensure that the public are well informed so that they can start thinking of social distancing measures. They can start thinking of hygiene practices and other activities that can help the communities, to start thinking of, to start practicing, basically. Then with our Ministry of Foreign Affairs and Trade Ministry, again, as you've seen there is no information written there. However, from today's meeting, we were able to get information that our Ministry of Foreign Affairs are communicating with our embassies outside the countries. And one of the activities within that is for the government to identify funding sources that are sisters and brothers that are situated in the embassies have some sort of a hazardous pay or other benefits or other benefits that will assist them in terms of assisting the Marshallese citizens that are abroad. Also, within the response plan, we also activated our ports of entry, which is led by RMI Ports Authority and other agencies that are members of the ports of entry working group. We also wanted to see, because although we have closed down the border, it doesn't necessarily mean that we have stopped all container vessels or all aircraft vessels that are delivering essential services to the countries. In other words, the container vessels that are coming here, the sea vessels, they are still continuing bringing in essential items such as food, fuel, and other essential items. For the maritime, because of the fishery agency, again, we want to ensure that the maritime surveillance group, the fishing vessels that are outside or within our EEZ fishing, we want to ensure that they also comply with our travel advisory and also with the standard operating procedures that are developed by our maritime working group. For the neighboring island, or in other words, our outer islands, two key activities that are undertaken right now is to provide a food basket in order to prep the people at the outer islands if, again, we're basically basing it off from the scenario that if there's an internal lockdown, we want to ensure that by providing food basket to the outer island, we want to ensure that the outer island people does not come to Majo to get essential item. So that is one of the essential item that NDMO and its other clusters that are undertaking to ensure that there is food basket ready for the people that are situated at the outer islands. With all of these, we also wanted to keep in mind the gender and protection lens to all of these preparation works that we're undertaking right now. For example, the schools in the RMI has been designated the temporary alternative care site as advised by our Ministry of Health. If again, they would come under or experience a surge capacity that may or may not take place. So we want to ensure that the schools are retrofitted in a way that is medically sound and also for the quarantine purposes. With that, we want to ensure that we want to cover the gender and protection issues that may or may not arise within the shelters themselves. Again, as I've stated earlier, there has been assessment being done. Again, we just had our NEOC meeting this morning, and again, I will share the current update. But for the interest of the webinar, I just wanted to present to our brothers and sisters from the other countries that, again, for these schools that have been identified as alternative care site, again, with the fact that we have limited resources on hand, we want to ensure that we utilize our current capacities to the best of their use. For education, the Ministry of Education or the public school system, with the assistance of the NEOC, have now developed their contingency plan for students if there is a lockdown. And one of the activities for that cluster is to provide the schools with Chromebooks and tablets for the students that can upload their studies or their school year studies while they go back to their house and stay within their house and continue their education. Now, some of the challenges that we face, again, as I've stated earlier, is the legislative framework. Although there is a current understanding that regardless of the COVID-19 not being within the country, the level of preparation work, as I would say, took a lot of energy for all the clusters and the cluster members just by doing preparation work. And because, especially with our finance team, again, we have to comply with our procurement code, regardless if, because where it stands right now for state of emergency, still we have to comply with the procurement code. But if it was a state of disaster, then some of these compliance will be then relaxed. But then again, because we are still in a state of emergency, we are complying. And some of the challenges that we face here is fatigue, clusters fatigue, to ensure that their preparation work are implemented accordingly. With all that being said, again, I would like to take the opportunity to thank everyone. And if there are any questions, I will stand by for questions that will be written, if I understand correctly, in the chat box. Thank you very much. Back to you, Chair.
Thank you, Director Ndiamo, Marshall Island. One of the things that we've picked up as part of the, as listening to the presentations that have taken place, is how important it is to have government structures that has successfully been implemented over the years, and that in an impact of COVID-19 as well as the different cyclones, our structures have been successfully enable us to implement our response, all within the confinement of COVID-19. In addition to this, one of the things that I've picked up in the presentations from all three presenters is the importance of humanitarian aid work. So this is not only a government approach work that we do, but indeed a whole of government as well as donor and partners as we try and revive and bring normalcy back to our individual countries. With that being said, I thank you again to all our panelists. I now open the floor for questions. I will also provide an opportunity for the PRP support unit to collate the questions that were sent through the chat, and we'll also make an effort to respond to such questions. Our first question raised this afternoon is from Andy of UNDRR. I would like to direct this question to Director Ndiamo Tuvalu, and I would like to get a reply as well from Director Marshall Islands. In your opinion, what is one of the change in government's arrangement that would help your country next time to deal with even more and more effectively with a pandemic? Just repeating the question again. In your opinion, what is one of the change in governance arrangement that would help your country next time to deal even more effectively with a pandemic? I hand over the floor to Director Ndiamo Tuvalu. If you could please respond to that question, please.
Thank you very much, Madam Facilitator, and also the one that asked that question. A very useful question for us to understand. However, the Ndiamo Tuvalu currently thought that perhaps the review of our current legislation is one of the key arrangement for us at the meantime. So we need to review our legislation so we can incorporate pandemic COVID-19, and likewise, then we can well prepared for future disasters after another disaster.
impacts in the daily recovery.
Thank you, Director. May I please ask Director Timmy if you have a response on that as well?
Yes. First off, I want to thank Andy. And Andy, good to, I would say, hear and see your question again after many, many months. So for your question, Andy, I think my opinion for that, the one change in governance arrangement, again, is the legislative framework that we currently have. Because as I've stated in my presentation, one of the challenges that each of us face here in the country, we want to ensure that if we're going to procure a certain item, now we also have to bear in mind that some of these items cannot be found on island. But one of the challenges that we face is that we have to order outside, and there are compliance that we need to comply with in terms of ensuring that if this is the right vendor, if this vendor have a good status among many vendors that we may select. So I guess to answer your question, from my opinion, Andy, is that one change in governance arrangement that would help RMI is the update and amendment of the legislative framework that we currently have. Thank you.
Thank you, Director. Maybe I'll just share a bit on the Fiji component as well in regards to how effective the arrangement could be done. Fiji is now also investing more into preparedness. As most of you are aware, we have the National Disaster Risk Reduction Policy that outlines 122 action activity that prepares Fiji, as well as other ministries and donors and partners when to activate, as well as take lead role and ownership on the development that they do within the space of disaster risk reduction. In addition to that, as you may have heard also earlier, Masaka did mention that the Natural Disaster Management Act that governs the role of Fiji's NDMO is currently under review. The big change that we have in the Act is the removal of the word natural to national. And therefore, the Fiji NDMO will be, upon the endorsement of the revised Act, will be coordinating all disaster, including pandemic, but only supporting those that are, supporting lead roles to the disasters that have occurred. With that being said, we will also handle all other disasters apart from civil unrest. So this is an approach that Fiji is currently doing in terms of preparedness. Thank you, Andy, for that question. We'll move now to the second question. This question is directed to Director NDMO Marshall Island. Can you please speak more on previous prohibition of travels relating to dengue or measles? Director Timmy?
Yeah, I'm here. I am reading the questions that was asked by. Okay, sorry, I apologize. I cannot pronounce your name. Okay, so the question is.
Can you please speak more on previous prohibition of travels relating to dengue or measles that may help COVID-19 measures?
Okay, for I would use for the dengue outbreak that we had here in the country, because of limited, I would say, medical supplies, pharmaceutical supplies that we had at that time, we banned vessels or people to go to the outer islands from Majuro, solely because we didn't want the sickness to be at the outer islands. Not only that, but also because of the current limited capacity our outer islands are facing right now. I'm not sure if I did answer your question, but if not, I will scroll down to the list of questions here and find the ones that are address to RMI and answer accordingly, if that's okay with you, Madam Chair.
Thank you, Director. That's fine. Thank you for your reply as well. We'll raise this additional question. The question from John Hopkins. How integrated was the COVID-19 response between the NDMOs and other agencies or departments, particularly Ministry of Health? Since I still have you on speaker, Director NDMO Marshall Island, may I please have your respond on that particular question?
Sorry, Madam Chair, I kind of lost you in the beginning. So is the question in relation to the disabilities?
How integrated was the COVID-19 response between NDMOs and other agencies, particularly the Ministry of Health?
Okay. The integral or the integration between NDMO and the Ministry of Health, because we are following the UN cluster system. The health cluster are members of the National Emergency Operation Committee. I guess the level of communication and coordination between the two entities, I would say it's good that we were able to pre-identify some of the issues that we are now addressing. So the integration, not just within the clusters, but if for agencies that they're not members of the clusters, again, because of COVID-19, we're not just dealing with WASH, we're not just dealing with health, infrastructure. We also approach our ports of entry or points of entry agencies. That way, they may not be a cluster member, but because of the event or because of the nature of the COVID-19, border control is one of their key areas, and we want to make sure that they are involved in the COVID-19 preparation, not only preparation, but for the worst case scenario event, we want to make sure that they are part of the response plan working group as a whole, if that makes any sense.
Thank you, Director. I'll also ask Director Tuvalu if you have a reply to that question, please.
Thank you, Madam Facilitator. Thank you again, John Hopkins, for the questions. I think currently the Tuvalu NDMO is much more focused on the TCT recovery, vulnerability reduction plan, implementation of immediate activities. Well, COVID-19, the Honorable Prime Minister did declare the state of emergency to establish under the regulation. We already established a national task force to handle COVID-19 preparation. However, the Ministry of Health was included in this national task force. Likewise, the Tuvalu NDMO and all key stakeholders, government stakeholders, are all part of this national task force for COVID-19. Therefore, the Tuvalu NDMO is slightly focused on the TCT recovery at the same time as part of the national COVID-19 task force. Thank you.
Thank you very much. In terms of features cases, how we integrate laws and policies, especially with NDMOs and national disaster, the health sector, and also when it comes to the COVID-19, we have to ensure that it's a whole of government approach. Health for us, takes the lead, while the National Disaster Management Office provides support, a holistic approach, a whole of society approach, people-centered approach. For example, health looks into the containment of COVID-19. And while the National Disaster Management Office looks at logistics and how we ensure, together with other sectors like the Ministry of Agriculture, RFMF, and Fiji Navy on safety and protection, food security and livelihood. When we are dealing with disasters, these are other aspects that we really need to take into account. Apart from that, we also have a Fiji cluster system. This is actually the translation of the UN cluster system into a more contextualized Fiji sense. In that case, for example, the Ministry of Agriculture is the lead for the food security and livelihood cluster, and it's co-led by WFP and FAO as well. And of course, all in all, when it comes to integration, the National Disaster Management Office convene inter-cluster meetings where issues from the 9 clusters currently present here in Fiji is shared among partners, stakeholders, so we can find innovative solutions. It's sort of some way in terms of how we evaluate ourselves also, and monitor, evaluate, and learn from that in a very specific context to disaster management and how we respond to it. And now touching on in the more legislation side, how do the legislation also look into empowering such structures as well? You know, these structures, these disaster management structures have been existing, for example, in Fiji since 1998. It is always wise to strengthen the existing structures that are in place, that are already in place, so that you continue to build on from the lessons learned and move forward, because those structures were placed there in accordance to the experiences on the ground, and they are much more contextualized in the sense that it works. And that is why for us in the Fiji approach, we are continuing strengthening the existing structure. For example, we have the disaster management structure. When it comes to policy review and legislation, we're looking to the inclusion of the Fiji cluster system in our current review. With that, Chair, I thank you.
Thank you, Ms. Saki. I will now move to a question posed by FNU. The question is if the Fiji delegation could update how many schools were affected by TC Harrow. 123 schools were affected by TC Harrow, either reported damaged or destroyed. And the second part of the question is, what is the status of repairs? For that, the Ministry of Education has an early recovery plan for the education sector, which is currently being implemented. Schools in Fiji have started after an extended break, and the education and the Ministry of Education implementing initiatives to get the school operating as normal. But in the context of what's the status of the repair, this is something that we are currently working with the Ministry of Education here in Fiji to ensure that all schools should be ready as soon as possible. We'll now move the question to Tusi. How does the current review of the Fiji Natural Disaster Act address future pandemics? And what about other disasters? As I'd mentioned earlier, the draft act will ensure that Fiji National Disaster Management Act will be catering for all disasters other than civil unrest. Apart from civil unrest, all other disasters are already included in National Disaster Management Act. I hope I've answered your. We'll move now to Simeone. His question is, how ready is the Pacific in ensuring that persons with disabilities are not left behind? How are you ensuring that their accessibility to COVID-19 response and access to information for all persons with disability and the reflection on disability inclusion in regards to policy and legislative framework? I will now ask my colleague, Dr. Andy Mo Marshall Islands, to please respond to that And then we'll ask Director Ndiamo Tuvalu to also add his contribution to that question. Thank you, Director Ndiamo, Marshall Islands.
Thank you, Madam Facilitator. So I guess to answer the first bits of the question is how ready is the Pacific? My words that I've been telling my staff here is that if we think that we are ready, we are not. We like to be 1000% ready. So the continuous work of being ready is still ongoing. However, for the gist of the question, for disabilities here in the Marshall Islands, I would just say that because of the gender and protection clusters that we have, we want to ensure that the disability group are well connected to the overall response plan and preparedness plan. One of the activities that we, for information sharing or information management, if there are interviews being done by our Minister of Health or colleagues from Ministry of Health, there is a visual/audio conference that is shown on Facebook, on other social medias. There's a small section where we have sign language that we want to ensure that we encapsulate other disabilities issues. So that is one activities that we have undertaken. For the other disability group, again, we are still doing our best to ensure for those that have visual impairment. Again, these are some of the activities that RMI itself is trying to be creative of what other ways that we can involve them more. As per policies and legislative framework, the current Disaster Resistance Act that NDMO is operating under, again, and I think Madam Facilitator mentioned it a few minutes ago, instead of natural disaster, we want to ensure that we capture the meaning of a national declared disaster. This will again includes disability lens, also the other cluster or other areas that needs to be incorporated within the Disaster Resistance Act. So again, at this time, because of multiple hazard response that RMI and DMO has been taking, I'm pretty sure that that is one thing that we need to do in the coming years or months, in the coming months or years, sorry.
Thank you, Director.
Over to you.
Thank you, Director.
Sorry.
May I please ask Director Ndiamo Tuvalu his response to that question, please. By Simeon Mbu. If you're looking at the group chat, please.
Thank you very much, Madam Facilitator. Tuvalu, after TCTino, lesson learned, there are issues for us to consider disability. Our future assessment consultation with communities. Though we are part of we are signatory to the CRPD, and we thought that in this review of our legislation framework, we will include people with disability in this review and our community consultation. Thank you very much.
Thank you, Director. In regards to Fiji, during Fiji disaster review consultation, we've had advocacy with customs to address any shortage of persons with disability aid by requesting concessions on capital assets for PWD, starting up a business to manufacture artificial limbs or other disaster aids. We are also looking at legislating the gathering and the use of disaggregated data so we know where PWDs are and their specific needs for disability aid. In addition to that, the Fiji NDMO during TC Sarai, it started off with TC Sarai and trickled all the way down to COVID-19. We've started the having those with the sign language as part of our media briefings. The sign language was part of our media briefing. In addition to that, for the first time in Fiji's history during TC Sarai, the disability sector in Fiji actually opened their very own emergency operations center. That in itself was an achievement because they were able to, those living with disability were able to channel their queries and their questions directly to the relevant authorities. And if the organization was able to address the queries, they would do that right there and then. However, should they need international national assistance, then all the queries were redirected to the NDMO. And therefore, reiterating the importance of collaborations and working with partners and ensuring that no one is left behind. These are small gestures that we do that makes a difference to those living with disability. With that being said, we'll move on to the question posted by Shelley from MFET. How has the public responded to law changes to better respond to multiple disaster response and potential impacts on people, business, and school? I would ask Director Tuvalu to please first address that question by MFET, please.
Thank you, Madam Spectator. Yes, when Tuvalu declared the public state of emergency for health pandemic, we were at the stage of the community were very panicked during the lockdown period. I think that's the very first of its kind in Tuvalu for a community lockdown without any consultation with the community. That's one of our lessons learned. So there, for our review, framework for our legislation review, we were thinking of putting that back to the community and see what are their feedbacks on that lockdown. I think that's all I can say for that, Shirley. Thank you very much.
Vinaka Director NDMO Tuvalu, may I please ask a response from Director NDMO Marshall Island, please?
Okay. Thank you, Madam Facilitator. How has the public responded to law changes? Right now, I mean, if we're gonna go deep down into the changing of the law, right now that hasn't taken part. However, for public consumption or public perception of the borders lockdown, I like to share that it was I would say interesting, because you have the other side saying, okay, why is the National Disaster Management Office advising the government to lock down the borders? What about our families that are stranded outside? What are they going to do? On the other side, they're saying it's good that we're keeping our borders closed, because again, with all of the underlying conditions that RMI, not just RMI, but us Pacific Island are facing, I would say NCD, diabetes, people are scared. And for businesses, schools, again, with the current standard, they are developing their, for businesses, most of them have developed their continuity, business continuity plan of what are they gonna do if there is a lockdown? How are they gonna practice social distancing, etc. For schools, again, like I've said, the schools have already developed their contingency plan. If there's a confirmed case on island, and if there's a lockdown, students that will upload their studies for that school year take it back to their homes, and continue their education while they're being at home. But again, to answer the main part of the question, it was, I wouldn't say shocking, but it's that feeling of uncertainty that people, especially the public, they were very concerned about. But like I said, it has two sides of the story. One, they're saying, why are we keeping the borders closed? The other, they're saying vaccine, and then we can open up the borders. Thank you, Madam Facilitator.
Thank you very much. Thank you very much, Shelley, for the question. So the question is basically on the public response when we have a change in regulations or legislation. The way Fiji is approaching it is, since we're still reviewing our current Natural Disaster Management Act of 1998, through the endorsement of the National Disaster Risk Reduction Policy, one of the action items that NDMO is currently in Fiji, for instance, is the mainstreaming of disaster risk sector. So what have Fiji done in that respect? We have conducted two national consultations, first within government. So how we can work together in terms of disaster risk reduction. With respect to all sectors, infrastructure, agriculture, with all that, and also in terms of private sector, that is what we are trying, or we are mapping towards, further develop relationships on mainstreaming disaster reduction to the private sector. So we have the Business Resilience Council here in Fiji, the Resilience Council here in Fiji, and these are entry points in which we can tap into to mainstream their concepts, and that when the legislation is passed and has these concepts in there, they are fully aware, and also in line with that, we have done massive consultations across the board, from grassroots level to individual ministries on proactive measures towards disasters, and also their approach towards reducing existing risks and also trying to prevent new ones. So this is the way forward in which NDMO Fiji is approaching this legislation review, and also to ensure that the public is also well informed through awareness programs that we have. With that, I thank you very much for the question, and thank you very much, Madam Chair.
Thank you, Mesaki. Ladies and gentlemen, we will now have the final question. Unfortunately, I can still see some questions coming through, but due to time limit, we will only take one more questions, and the ones that have not been answered, we will circulate them. We will address it and circulate it by email. The question is raised by Chosa, and it's directed to Director NDMO Marshall Island as well as Tuvalu. What are the roles of CSOs during disaster embedded in your respective legislations or policies? That question is directed to Director NDMO Marshall Islands as well as Tuvalu. May I ask Director Marshall Islands to please address that question? The roles of CSOs.
Thank you, Madam Facilitator. Clarity check. So CSOs, are we referring to the civil society organizations? Okay. All right. Because CSOs, when we use it here in the RMI, we call it the Chief Secretary's Office.
Okay. Thank you.
Okay. So the roles of the civil society organizations, as it stands right now, because we are in the process of amending our two acts, the Emergency Act and the Disaster Resistance Act, we also want to embed the roles of civil society organizations, also the private businesses, and other key players that will have roles and responsibilities during a disaster. But right now, for this COVID-19 exercise, and not only COVID-19, but also other hazards such as wave inundation or storm surge. The roles of the civil society organizations, we want to ensure that they capacitate our information management sharing or dissemination to the wider public areas. And not only that, because we have a youth-based organization and also this faith-based or churches. As we all know, we're all Christians, and we have set up not an MOA or MOU, but a verbal understanding with our faith-based group that in times of a disaster, we would need your assistance to ensure that the public at large do not panic, but also ensure that everything is planned, or everything is planned under the will of our Creator. So back to the question, we have not embedded the roles of CSOs because we are in the process of amending the Disaster Assistance Act and the Emergency Act. However, that does not stop us from engaging with them to be part of a disaster response. Thank you, Madam Facilitator.
Thank you, Director. May I please have Director NDMO Tuvalu's response, please?
Thank you, Madam Facilitator. For Tuvalu, we have the whole of country approach for our legislation. I believe that's applied to all countries. But in our legislation, I think only the Red Cross roles were enshrined in our legislation. But in real practice, all CSO, NGOs, even our communities have part to play in our legislation and policies. Thank you.
Thank you, Director NDMO. Ladies and gentlemen, members of the forum, that brings a closure to our webinar this afternoon. And for that, I would like to summarize for Tuvalu, Fiji, and RMI NDMOs through the experiences that they've shared with us today, have identified possible areas of intervention to improve relevant national legislation. From the recent meeting of the TWG on risk governance, similar experiences were shared by other NDMOs around the region. And to this effect, the TWG on risk governance has commissioned a mapping on legal and policy response to climate change and disaster in the time of COVID-19 in the Pacific, and to encourage active participation from our NDMOs